السلام عليكم ورحمة الله، مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك. Review of Prometric Test Question. Today we are going to discuss 5 questions from question number 99 up to question number 103. معكم محمد عثمان يعني. نبدأ مباشرة. Question number 99. The nurse is monitoring the amount of located rate in a client who is 2 hours postpartum and notes that the client has saturated perineal pad in 15 minutes. How should the nurse respond to this finding initially? يراقب الممرض كمية دم النفاس لدى السيدة بعد ساعتين من الولادة، ولاحظ أن الفوطة الصحية قد تشبعت في 15 دقيقة. كيف يجب أن يستجيب الممرض لهذه النتيجة في البداية؟ The options are number A. Document the findings. Number B. Encourage the client to ambulate. Number C. Encourage the client to increase fluid intake. Number D. Contact the healthcare provider and inform the healthcare provider of these findings. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. In this question, the correct option is option number D, which is contact the healthcare provider and inform the healthcare provider of this finding. ليه اخترنا الخيار رقم D؟ نشوف المبررات. Rational. Lochia is the discharge from the uterus in the postpartum period. It consists of blood from the vessels of the placenta side and debris from the deciduum. This is the definition of the lochia. The following can be used as a guide to determine the amount of lochia. نشوف كيف نحدد الكمية بتاعت دم النفاس ومتى نقول في نزيف أو ما في. طيب. ممكن نقول scant إذا كانت less than 2.5 cm on menstrual pad in 1 hour زي دي يعني scant, and light إذا كانت less than 10 cm on menstrual pad in 1 hour زي دي light, and moderate إذا كانت less than 15 cm on menstrual pad in 1 hour like this, and heavy إذا كانت saturated menstrual pad in 1 hour دي بنقول heavy, and excessive نقول excessive إذا كانت menstrual pad saturated in only 15 minutes just زي دي لكن في خلال 15 دقيقة. طيب يعطي فين الطبيعي؟ normal amount is from scant to moderate يعني scant لغاية moderate نحتاج الطبيعي. وصلت heavy and excessive بيعتبر هنا في hemorrhage وبالتالي مفروض نبلغ health care provider. So if the client is experiencing excessive bleeding, the nurse should contact the healthcare provider in the event that postpartum hemorrhage is occurring. So the correct option is option number D, which is contact the healthcare provider and inform the healthcare provider of these findings. Regarding to the option number C, which is encourage the client to increase fluid intake, it may be appropriate to encourage increased fluid intake, but this is not the initial action. And regarding to the option number B, which is encourage the client to ambulate, it is not suitable to encourage ambulation at this time. And regarding to the option number A, document the finding, documentation should occur once the client has been stabilized. So the correct option is option number D. Question number 100. The nurse has provided discharge instructions to a client who delivered a healthy newborn by cesarean delivery. Which statement made by the client indicates a need for further instruction? قدم الممرض تعليمات الخروج للسيدة التي أنجبت مولودا سليما بعملية قيصرية. ما البيان الذي إذا أدلت به السيدة يشير إلى الحاجة إلى مزيد من التعليمات؟ The options are number A. I will begin abdominal exercise immediately. Number B, I will notify the healthcare provider if I develop a fever. Number C, I will turn on my side and push up with my arms to get out of bed. Number D, I will lift nothing heavier than my newborn baby for at least 2 weeks. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. Note, the strategic word need for further instruction. الكلمة دي. This word indicate negative inquiry and ask you to select an option that is an incorrect statement. تختار الخيار الخاطئ أو السلبي. طيب هنا هيكون الخيار السلبي شنو؟ اللي هو number A. In this question the correct option is option number A اللي هو I will begin abdominal exercise immediately. طيب ليه اخترنا الخيار رقم A؟ نشوف. Rational. Remember that abdominal exercise should not start immediately after abdominal surgery. The client should wait at least 3 to 4 weeks post-operatively to allow for healing of the incision. So the correct option is option number A. I will begin abdominal exercise immediately. إذا الست قالت الكلام ده بتحتاج إننا نعيد لها التوجيهات أو التعليمات بتاعت الخروج. Regarding to the option B, C, and D, I will notify the healthcare provider if I develop a fever, and I will turn on my side and push up, and I will lift nothing heavier than my baby, are appropriate instruction for the client after cesarean delivery. دي أشياء جيدة. فهنا في السؤال دي ما عايزين الشيء الجيد، عايزين الشيء السلبي. So the correct option is option number A. Question number 101. After a precipitous delivery, the nurse notes that the mother is passive and touches her newborn infant only briefly with her fingertips. What should the nurse do to help the woman process the delivery? بعد الولادة السريعة لاحظ الممرض أن الأم سلبية ولا تلمس مولودها الجديد إلا لفترة وجيزة بأطراف أصابعها. ماذا يجب أن تفعل الممرضة أو الممرض لمساعدة المرأة على تصديق الولادة؟ The options are: encourage the mother to breastfeed soon after birth. Number B, support the mother in her reaction to the newborn infant. Number C, tell the mother that it is important to hold the newborn infant. Number D, document a complete account of the mother's reaction on the birth record. وقف الفيديو هنا واختار الخيار وشوف صحيح. In this question, the correct option is option number B, which is support the mother in her reaction to the newborn infant. ليه اخترنا الخيار رقم B؟ نشوف المبررات. Rational. Precipitous labor is a labor that lasts 3 hours or less. ولادة سريعة أخذت 3 ساعات أو أقل. دي بنسميها precipitous labor. Women who have experienced precipitous labor often describe feeling of disbelief that their labor progressed so rapidly. ما بتصدق إن الولادة يعني مشت بصورة سريعة كده في 3 ساعات فقط. So to assist the client to process what happened, the best option is to support the client in her reaction to the newborn infant. So the correct option is option number B, which is support the mother in her reaction to the newborn infant. Option number A and C and D, encourage the mother to breastfeed soon after birth and tell the mother that it is important to hold the newborn and document a complete account of the mother's reaction on the birth process. Those options are not acknowledge the client feeling. ما بتخاطب أو ما بتحل المشكلة بتاعت الشعور بتاعت الست. فبالتالي the best answer is to support the mother in her reaction to the newborn infant. Question number 102. The nurse is providing postpartum instruction to a client who will be breastfeeding her newborn. The nurse determined that the client has understood the instructions if she makes which statement. يقدم الممرض تعليمات بعد الولادة للسيدة التي سترضع مولودها رضاعة طبيعية. يحدد الممرض أن السيدة قد فهمت التعليمات إذا أدلت بأي تصريح أو بيان. The options are number A. Drinking alcohol cannot affect my milk supply. Number B. The use of caffeine can decrease my milk supply. Number C. If my breasts get engorged, I will limit my breastfeeding and supplement the baby. Number D. I should use soap to cleanse the breasts. وقف الفيديو هنا اختار الخيار بالشوف سهل. In this question, the correct option is option number B. The use of caffeine can decrease my milk supply. ليه اخترنا الخيار رقم B؟ نشوف الراشن. Common causes of decreased milk supply include inadequate rest. دي الأشياء اللي بيقلل اللبن. Inadequate rest or diet, smoking by the mother or others in the home, and use of caffeine, كذلك alcohol or other medications. So the correct option is option number B, which is the use of caffeine can decrease my milk supply. إذا الست قالت الكلام دي بتشير لنا إنها فاهمة التعليمات. طيب. At the same time, option A should be eliminated. ليه؟ لأنها drinking alcohol cannot affect my milk supply. لأن العكس يعني affect the blood supply أو the milk supply. And regarding to the option number C, if engorgement occur, the client should not limit breastfeeding, but should breastfeed frequently. And regarding to the option number D, soap should not use to clean the breast. So the correct option is option number B. دي إذا قالت الست بتوضح لنا إنها فاهمة. باقي الخيارات إذا قالتها بتوضح لنا إنها ما فاهمة. ونحن عايزين البيان أو الكلام اللي بتوضح إنها فاهمة التعليمات بتاعت الرضاعة الطبيعية. So the correct option is option number B. Question number 103. The nurse is monitoring a client in the immediate postpartum period for signs of hemorrhage. Which sign, if noted, will be an early sign of excessive blood loss. الممرض يراقب السيدة في فترة ما بعد الولادة مباشرة بحثا عن علامات النزيف. أي علامة إذا لوحظت ستكون علامة مبكرة على فقدان الدم المفرط. Excessive blood loss. The options are number A. A temperature of 100.4 Fahrenheit أو ما يساوي 38 سنتيغراد. Option number B. An increase in the pulse rate from 88 to 102. Number C. A blood pressure change from 130/88 to 124/80. Option number D. An increase in the respiratory rate from 18 to 22 breaths per minute. وقف الفيديو هنا واختار الخيار بالشوف سهل. In this question, the correct option is option number B, which is increase in pulse rate from the 88 to 102. ليه اخترنا الخيار رقم B؟ نشوف rational. Increased pulse rate is an early sign of excessive blood loss because the heart pumps faster to compensate for reduced blood volume. So the correct option is option number B, which is an increase in pulse rate from the 88 to 102. Regarding to the option number A, temperature of 104. A slight increase in temperature is normal immediate post delivery. Regarding to the option number C, a blood pressure change from 130/88 to 124/80. The blood pressure decreased as the blood volume diminished, but a decreased blood pressure will not be the earliest signs of the hemorrhage. هي من علامات فقدان السوائل لكن ليست العلامات المبكرة. Regarding to the option number D, The respiratory rate is slightly increased from the normal immediate post delivery. So the correct option is option number B. شكرا جزيلا ونتقابل إن شاء الله في محاضرة جاية. Don't forget to support us by comment or like or subscribe. مع السلامة.